I actually came to Purdue Calumet for my undergraduate nursing degree, and I really enjoyed it here. I liked the experience, and the faculty is very nice and very helpful, and a lot of the faculty do both the undergraduate and the graduate program. So I knew a few of the people here, and I just really enjoyed it, and I thought I should come back. I like a lot of the different aspects of the program. I'm in a family nurse practitioner program. There are different branches of the master's program. And in my program, we learn about the family from infant all the way through the elderly population. So with our experiences, we do some clinical rotations. So I've worked with children, I've worked with pregnant women, I've worked with like elderly and adults. So it's just interesting to see everyone through the whole lifespan and get just the broad experience of the whole world. Professors are very helpful. They're very open to questions, and they'll give you, their phone number and their email, and you can reach them at different times. I've had a great experience with all of them. No matter what you ask, they never make you feel like you're stupid for asking a question or that it's a silly question. They're just very helpful, and they just want the best for everyone here. I really like the faculty here, and that's why I chose to come back here instead of going to a different master's program, because I really felt a connection with them in the undergraduate program, and I felt that they could really help me expand in graduate school. For the most part, the graduate program focuses more on primary care, so we're actually working out in the field. We make arrangements with different clinics or hospitals or offices, so we're working a lot outside of the school campus. But we do have, mostly we have one course on campus where we use the facility, and we'll use the assessment labs, and they have different equipment that will help prepare you to transition into the office setting. They'll show you different techniques you can use and different equipment that they might have, and all the offices are different, so they kind of give you a glimpse, a little bit of each thing here and there, so you can kind of adjust. And then we even, for one of our programs, before we go into the clinic setting, before they send us out in the real world, we have professional patient models that actually come in. It's a company we hire, and we can do assessments on them, and it's just really nice to have that experience before you work on real patients. These are professional, they've done it numerous times, and so they help you, and they help you feel prepared and comfortable talking to people before they send you out. So I really like the experience, and I like just the different opportunities here. Everyone, for your clinical setting, how it works is you actually can choose where you want to go, so it's very open, and they offer a lot of freedom and independence, but they're still there to help you out if you have a problem. So what you do is, you look for an office that maybe is closer to your home, because different people, commute, and there's also an online program. So the online students might find something closer to their home. And you will just call up, the office, the nurse practitioner, or in some cases a physician that you're interested in training with, and you'll talk to them, and you just fill out some paperwork and get a contract, and then our office here, the graduate office, will take care of it. And they make sure that there's a contract, that there's malpractice insurance, and all the little details are worked out by the office so that you really can choose what experiences you like. So everyone's somewhere different. So it is different than the undergraduate program where you'll have 5 students at the same hospital or working on the same floor. Here you'll have 1 student per each nurse practitioner or physician just all over the area. Even, there are some in South Bend and areas farther where they make arrangements. So it's just really unique to be able to find something close to home or something that you really enjoy. Like for pediatrics, there are tons of different offices and settings, and you can just find a preceptor that you connect with, so you feel like you don't have to go with someone that you don't know. If that's the case, if there's somebody you can work out a contract with them and work in their office where you feel comfortable and where you feel like you can get the best experience. And then the final semester, which is the May through August semester, you can do so many specialty hours, because beforehand every semester is a different age group, and you need to stay in that age group. Like one semester you'll work with pregnancy, one you'll work with children, one you'll work with adults. And in the final semester, you can pick 50 specialty hours, so you can work anywhere you want. You can work in a hospital or in an ICU setting. You could do orthopedics, where they work with bone doctors or skin doctors, whatever you really find interesting. So they let you kind of, pick a genre or an area that you really like, so you can enhance that area maybe if you're thinking about going into that for a career, so you can see if you like it first. So it's really good. 2 different career goals. When I started, I was just planning just on working as a nurse practitioner. I didn't know exactly where. I kind of like children, so I thought I would want to work with the pediatric population. But while I was here, the dean sought me out and told me about a program that's called the Bridges to the Doctorate program, and they partner with UIC in Chicago, and they offer a PhD program. And so you take some courses in your master's here, a few courses in UIC, and it kind of like bridges into a PhD. So I'm actually thinking I want to practice as a nurse practitioner, but I also might go back to school and get a PhD in nursing research. So you can just expand on nursing and, do research that can help make the world a better place. Yeah, I would recommend it. I think it's a really good program. One unique thing about Purdue Calumet compared to even other nursing schools in the area is we have something called the Joanna Briggs Institute. It's a worldwide nursing research institute, and there are different locations around the whole world, and one of those locations is here. So our faculty, Dr. Lisa Hopp, she actually runs the program here, and she communicates with the other centers around the world, and it kind of just helps get evidence-based research. You can provide the best nursing care that's based on evidence, and just find the best research to show what helps, what doesn't help, and what works. And Purdue Calumet actually has that, and we're one of the only centers in the United States that has that. So it's very nice to have that here.